A cordial welcome to our forum. We invite users to answer the question that doctors have read. We are interested in learning about the most egregious case of malingering you have ever observed. A 30-year-old woman presented with a history of severe abdominal discomfort and claimed to be paralyzed. She described a sharp, intense pain when pressure was applied to a specific area. The patient requested immediate access to oxycodone. The attending physician advised that if the patient could perform 20 jumping jacks, the oxycodone would be provided. The patient completed the exercise and was subsequently discharged from the hospital. We would be grateful to hear about other cases of similar malingering. A similar account was provided by an emergency medical technician, EMT, who had previously worked with me. This individual had encountered a patient who had walked to the ambulance and appeared to be in no discomfort. Despite this, the patient became unresponsive upon arrival at the emergency department. The EMT commented that it was unfortunate that the patient was unresponsive, as it meant that pain medication could not be administered. The physician and nurses were present when I informed the patient that she would not receive pain medication. I then left the room. On the other hand, there is a story from your solace in which I was asked to leave an urgent care clinic. I had presented with severe abdominal pain. The initial assessment involved pushing up parts of my stomach that were not injured. The conclusion was that I was faking the pain and that I should seek pain medication elsewhere. A nurse observed me in pain while I waited to pay my copay. She recommended that I seek care at a hospital if I was not faking my symptoms. She provided directions to a distant hospital. There was a nearby hospital, but I am uncertain why I was directed to the distant one. I drove there myself. During my examination at the hospital, the medical professionals performed an abdominal examination. They applied pressure to a lower portion of my abdomen than they had at the urgent care facility. They discovered that my appendix had ruptured. One might suggest that you could have remained in the emergency room for a few more hours. While there is a possibility that you might have died, you could have then sued the hospital for millions. My mother is an ER nurse, and she once treated a patient who complained of having whooping cough. She would cough and then follow it with a loud whoop. This response is an example of incorrect usage. The term eternity incarnate is not appropriate in this context. The next response is from Sensitive Info Max. My cousin received glasses at the age of 7. The younger sister also desired glasses because she considered them a status symbol. She began informing her teacher that she was unable to read the chalkboard and sheets at home. She also positioned herself very close to the television to watch programs because she claimed that she could not see them clearly. Her parents became concerned and took her to a medical professional. She incorrectly answered all of the vision test questions. The medical professional was somewhat uncertain about the necessity of glasses, given the results of the test. The glasses were particularly thick, which was not typical unless there was a family history of vision issues. Her parents both had 20/20 vision, and her sister only had astigmatism. They all realized she was faking it, so the doctor informed her parents in front of her that she needed some pretty intense eye surgery so she'd be able to see without glasses. They even wheeled in a machine to make it convincing to say they could do the surgery right then and there. She became visibly distressed and confessed to faking it all, beginning to cry. She was subsequently placed on a period of house arrest. Jessie then inquired as to her response. I recall fabricating the need for glasses when my brother first acquired them, as I found them to be aesthetically pleasing. It subsequently became apparent that I was, in fact, suffering from astigmatism. This anecdote bears resemblance to a narrative my father used to recount from his childhood. He had experienced severe abdominal discomfort, which he attributed to being in trouble for being unwell. As a result, he had assumed that feigning illness would result in some form of punishment. Despite experiencing severe discomfort, my grandfather attempted to reassure his parents that he was unwell. Consequently, my grandparents took my father to the hospital. However, the attending physician was initially unable to diagnose the underlying issue due to my grandfather's lack of cooperation. The physician's suspicions were aroused by the presence of symptoms suggestive of appendicitis. This condition is characterized by acute abdominal pain, particularly when pressure is applied to the affected area. He then inquired, "If you are perfectly fine, does this hurt?" Upon prodding with his fingers, my father vocalized his discomfort. Our subsequent response was a series of expletives and mutterings. As an intensive care unit and emergency room nurse, we frequently encounter individuals who feign illness in the emergency room setting. One of our regular patients arrived and began feigning a seizure in the triage area. I was aware that this individual had previously exhibited similar behavior on numerous occasions. However, on this occasion, it occurred in the lobby, in full view of approximately 30 people, who were unable to discern the truth. She was observed to be rolling around on the floor, creating a commotion and evoking expressions of horror from onlookers. I approached her and inquired in a composed manner, "Karen, could you please clarify what you are doing?" In response, she stated, "I'm seizing." I instructed her to cease the seizing, which she did. It is difficult to imagine the experience of being in that situation, merely observing the unfolding of events. One might perceive the nurse's actions as nothing short of miraculous. Our subsequent interactions involved a patient who, during my internship, feigned blindness. She would frequently engage in playful activities on the patient attempted to conceal her smartphone, which she was using in a clandestine manner, when a member of the care team entered her room. The most notable instance occurred when my attending physician, in a seemingly casual manner, walked past her room and extended his hands in a gesture that was both exaggerated and somewhat comical. The patient, in an attempt to conceal her actions, began to throw up her arm, but abruptly stopped midway through. She then returned her hand to her lap and feigned a state of deep contemplation, as if she were lost in thought. Given the circumstances, it is surprising that patients would resort to faking blindness, particularly when there are other conditions that are more commonly associated with such behavior. However, upon reading the responses to this post, it became evident that this is, in fact, a phenomenon that occurs with some regularity. It would be beneficial to gain insight from medical professionals on this matter. I am intrigued to learn more. In my childhood, I learned that I could feign illness and attend school. On 1 to 2 days a week, I would experience a migraine and hold my hand and complain. Eventually, my parents took me to a neurologist who suggested limiting my intake of chocolate and sugar. I admitted to faking and was grounded for an extended period. In response, I indicated that I had experienced migraines with a frequency of 3 to 4 instances per week. However, it was commonly assumed that I was faking them because I appeared to be functioning normally. I was merely learning to cope with and act as if they were not occurring. It was not until 8 years after the onset of these episodes that I sought the advice of a neurologist, who diagnosed me with chronic migraines. I have been managing my condition without medication for 16 years. I am now taking medication. I feel that my childhood was wasted. Our next reply is from Jay. He is an ophthalmology technician who is responsible for monitoring eye pressure. I could have checked her eye pressure with a TON-Open, a device that is used to measure intraocular pressure. It involves inserting a device directly into the eye. The patient may be startled by the sensation. In response to this, Ruffy offers an alternative perspective. I have a somewhat contrasting anecdote to share. A friend of mine is completely blind, having had her eyes removed as a toddler due to a rare cancer. She has worn glass eyes her entire life to prevent the sockets from collapsing and to limit the visual impact. Recently, she knew the doctor was fitting her with new glass eyes, which may have been the reason why, when the technician brought her in, they informed her that they needed to examine her eyes and asked her to complete the vision test chart. She attempted to explain that she was blind, but they continued to examine her. It is noteworthy that she eventually reached a point of such frustration that she removed one of her glass eyes and stated, "Here, now you can examine it." This action was apparently a recurring response to individuals who doubted or teased her. She is, in fact, quite adept at handling such situations. It is also interesting to note that a medical professional, upon examining a glass eye, would likely not have been impressed. The eyes appeared to be made of glass, which seemed unusual. Let us commence the eye examination. When I was a child, I would plan my sick days well in advance. I had an old thermos that I would pour leftover milk, meat, and other items into. I would leave it on the windowsill in my bedroom, allowing it to ferment for approximately a month. The thermos was closed, so no odors escaped. An alarm was set for midnight, and the contents of the thermos were dumped on the rug. The author ran to inform their father that they were vomiting and extremely ill. However, the malodorous thermos filled the entire condo and caused both the author and their father to vomit into the tub simultaneously. Subsequently, we attempted to clean the rug, which necessitated that he take the day off work. It is worth noting that I did not repeat this action. Then, Virgin introduced a new strategy, which I was concerned might involve consuming the substance to induce vomiting. Fortunately, this did not occur. In our subsequent correspondence from Conqueror, which occurred years ago, I had a patient who had been rear. The patient's condition had deteriorated significantly by the time I saw her. She had a history of lupus and was wearing a plethora of supportive devices, including crutches, a neck brace, elbow braces, wrist braces, and knee braces, which severely limited her mobility. Despite multiple appointments, there was no discernible improvement in her condition. On a particular Saturday, I was on call but had to take an alternative route to the hospital due to an event occurring on the main thoroughfare. I proceeded to drive through her neighborhood, where I observed her power walking down the sidewalk while holding weights in both hands. I did not call out to her. The following week, she was back in the clinic with her. A few weeks later, I received a subpoena for a deposition, which revealed the truth. After someone asked what happened, I posted an update on Conqueror. I could not have sworn under oath that I had identified the woman powerfully. I was able to identify the woman walking by her residence. I later confirmed that she resided in that area. She and her attorney could have argued that it was her sister, daughter, or cousin, or another individual. Therefore, I simply answered all the questions honestly during the deposition. Many of the questions I could not answer because I did not see the woman immediately after the accident. However, I could still state with honesty that I believed the patient was expected to make a full recovery. It is not uncommon for individuals pursuing compensation through legal channels to overstate the extent of their injuries. All parties involved in the process are aware of this phenomenon. However, it is the responsibility of the patient to maintain the integrity of their narrative in a manner that is deemed believable. Our nurse responds, "No." Anecdotally, I recall a case from my professional experience. A male patient called in sick for approximately 8 days and, upon his return to work the following week, presented a medical certificate written in Spanish. The certificate was from a Cuban clinic, and the patient approached me with a grin. Her face conveyed a sense of resignation, as though she had already anticipated this outcome. "I'm not a doctor, but a nurse," she replied. "I once had a patient experiencing a seizure. The other nurse and I were aware that she was faking it." He confirmed this, and then she suddenly ceased seizing. She looked at him directly and yelled, "Shut up, fat boy." Both nurses were amused by this turn of events. He was subsequently referred to as "Fat Boy" for several months. It is noteworthy that he was not experiencing a seizure. In response to this, Cyborg stated that his wife works in a hospital as a radiographer. She has informed him of instances where nurses have observed individuals feigning unconsciousness. There are 2 reliable methods for detecting such behavior. These include knuckling the sternum and knocking on the clavicle without warning. An amusing anecdote was recounted by a nurse who had observed that even while in a state of unconsciousness, a person will instinctively avoid allowing their hand to come into contact with their face. The nurse proceeded to lift the patient's arm and drop it over their face, resulting in the unconscious person halting their hand in midair. Furthermore, a post from Chaos Yet Harmony was read, which in a similar vein, an EMT recently inquired of her partner whether he would kindly pass the ocular needle. The partner was obliged to request the ocular needle that was to be inserted into the eye of the patient. The patient then regained consciousness. Our subsequent responses were informed by the experience of working at a pharmacy, where we observed a man attempting to obtain a refill of pain medication that was not eligible for refill. After reiterating that his ear was severely painful, we informed him that we were unable to refill the prescription. One of the other employees observed him entering a side hallway and inserting a pencil into his ear with considerable force, resulting in lacerations and bleeding. He then calmly departed for the emergency room, returning a few hours later with the necessary medication. During my first year of medical school, I was on my internal medicine rotation when a trauma case was brought in. The patient had sustained a traumatic brain injury, TBI, after hitting her head 4 times against the window of the police car during the drive to the hospital. She was brought to our facility with a bruise on her forehead and was unresponsive. Despite the presence of a bruise and the patient's lack of response, we were initially skeptical about the circumstances surrounding the injury. The patient was a skilled actor and did not exhibit any discomfort during the digital rectal examination, DRE, which is a standard procedure for all trauma patients. However, some of the nurses on the team reported observing the patient peeking at them when they would leave the room. A CT scan was performed, which yielded normal results. The possibility of intubating the patient to secure her airway was even considered. However, when the attending physician finally approached the patient, opened her eyelids, and held them open while instructing her to wake up, the patient began to resist. This indicated that the initial assessment was incorrect. The doctor then proceeded to remove the patient from the room, whereupon she began to scream at the medical team. It is notable that the patient was more compliant when she was pretending to have a brain injury. This case highlights the importance of thorough patient assessment in the trauma room. Dear R/S members, I would be interested to hear about any instances where you have encountered similar situations. Our next responses from Molnar were as follows: 2 of my acquaintances had never met prior to speaking with one another. I informed both individuals that the other was somewhat hard of hearing. They proceeded to engage in a heated exchange for several minutes before realizing that I was a source of irritation. Our subsequent responses from Freud were images of his granddaughter, which I had copied and pasted onto my mother's laptop desktop. I then created a slideshow of these images, which displayed a new image every 10 seconds. One of the images was altered to feature a minuscule, curly mustache, which was randomly added for a 10-second period. My niece's mother initially believed that she was either experiencing a psychological breakdown or had inadvertently introduced a computer virus. However, upon each instance of the mustache's appearance, it would promptly disappear. Our next replies from Chrysler: a student's high SAT scores led me to teach 15 to 15 students, each with a different name. I am surprised that your professor approved of this approach, but I suppose the saying, K Sarah, Sarah, is applicable here. Our next reply is from Waffle Park. I had lived in Korea for a while when my mother came to visit. I informed my Korean girlfriend that it was an American custom to greet older women by touching elbows. I relayed the same information to my mother about Korean customs. They were not pleased. Our next responses were from an unkempt child. I observed a post about exchanging mayonnaise and vanilla pudding. I proceeded to empty a mayonnaise jar and clean it thoroughly. I then filled it with a few pots worth of vanilla pudding and took it to the university. As anticipated, the university has a lenient policy regarding food consumption during lectures. I waited until midday, when I was seated my friends and I were in the middle of our lunch when we noticed the jar of mayo. We were amused to see our friends taking the lid off the jar and eating the contents. At first, only the closest friends noticed, but after the 3rd spoon, it seemed as though everyone was aware of what was going on. After the 5th spoon, someone exclaimed, "Oh my goodness," and the spell was broken. The expressions of sheer terror and disgust were noteworthy. The pain of eating vanilla pudding was worthwhile. I am a chocolate kind of gal, and I grumbled. One of my friends informed me that he was going to pull this prank, so I helped him fill a jar with pudding. I then swapped his jar of mayo pudding with a regular jar of mayo. Our next replies came from Orchid Lighthouse. When my brother and I were in middle school, my brother liked to skateboard with our next. One day, my brother's neighbor removed the sheet of plywood from under my brother's upper bunk bed. The upper bunk was no longer in use and was subsequently transformed into a skateboard ramp in the neighbor's adjacent yard. My parents had explicitly forbidden this action. However, it is important to note that my brother had subjected me to relentless teasing on numerous occasions, which may have contributed to his decision to engage in this mischievous act. Nevertheless, he was ultimately met with consequences for his actions. I devised a plan and proceeded to the upstairs window, where I yelled down to my brother, "My mother knows everything and is extremely displeased." I then promptly closed the window and proceeded to the stairs, where I observed my mother reading the newspaper. A few moments later, my brother entered the house, visibly distressed, and apologized to my mother for his actions. My mother, who was unaware of the circumstances, expressed her forgiveness while slowly placing the newspaper down. At that moment, a wave of shock and realization swept across my brother's face, and our eyes met. I let out the most evil and mischievous little sister cackle and ran into my room. We are adults now, and I still laugh about it from time to time. Then, J. Gabriel replied to that. During the night when I was in middle school, I stayed at my friend's house while my parents were at work. This friend loved to torment me. One day, his 13-year-old brain thought it would be funny to I informed him that I would inform his mother of his actions. I then proceeded to enter the house and relay the situation to her. I advised him to feign disgust when Trevor arrived. However, when Trevor entered, he did not express any remorse for his actions. He simply stated that I was lying and that he did not urinate on the cats. I then informed his mother that I had not informed her of his actions. This incident remains one of the most memorable events of my childhood. The subsequent response was provided by Rainbow Dick. The supervisor at my office is a diminutive individual who has been working from a laptop on a rolling adjustable desk for over a year. I gradually increased the height of the desk and observed a gradual transition in his seating position, moving from a stool to an adjustable tall task chair to standing. Last week, he removed the wheels from the desk to lower the height. He is unaware that the desk is adjustable. Nurse Barco Shark offers a similar recollection from high school. A male student had a locker with a combination lock that could be opened in 4 directions, not in numerical order. One day, while the student was preoccupied, I observed him entering his combination. I promptly recorded it, recognizing an opportunity for a practical joke. I noticed that the locker adjacent to his was unoccupied. After class, I waited until the student left and took everything from his locker, placing it in the next available locker one space over. I then locked the original locker. The next morning, the student returned to school. The class was perplexed and inquired quietly if someone had moved his locker. His friends asserted that he was eccentric since nothing was stolen and everything was in the same place he had left it. The fact that he had written down his locker number and his planner was attributed to a mistake in writing and ignored. Consequently, the following day I moved his locker 5 lockers over. It was a fascinating spectacle to observe. This was r/s credit and my ass credit. I would like to pose a question to the audience. Did you remember to like and subscribe? If you haven't, I encourage you to do so.